I'm a medical cannabis patient advocate. I'm also an activist, and I've been a cannabis nurse educator for the last 9 years. I've been studying both cannabis law and the medicines for the last 9 years, and I don't practice medicine. I don't work directly with patients, and I don't give medical, legal, or dietary advice. And I don't make any money from my book sales, but I am hoping that people will come out and look at my booth when we're done here, because we have a little problem in that most healthcare professionals have no idea about the harms or the benefits of medical cannabis. And it's not their fault. It's not being taught in any medical school or nursing school yet. I was a member of a task force in 2022, and it was called the Dual Use of Cannabis Task Force. And what we were tasked with was looking at what would happen to our medical program if we legalized for adult use. And we created a survey. We worked with the Department of Health, and we created a survey, patient survey, and asked them, where do you get your health education when it comes to medical cannabis? And 57% of those said they got them from the dispensary workers. So we have a huge knowledge gap. And I've educated about 400 healthcare professionals so far. But by the end of this hour, you're going to know more than most doctors, nurses, and pharmacists on the planet. So I'm hoping that you will take information to them and ask your doctors, ask your nurses, ask them if medical cannabis education is right for them. Because I've been a cannabis nurse for 9 years, and last year we got some good news that cannabis nurses are going to be recognized as a specialty in nursing. So going forward, we're going to try to provide a cannabis nurse to any patient who needs one, wherever they are, if they're in the hospital or clinic. So I'm hoping that you can help me on this mission. Each one, teach one. So I'm hoping that you will help me by taking whatever you learned today and try to teach somebody else, preferably your healthcare professionals, and then come up to my booth and look at the resources that I have for you to take to them, and also for yourself so that you can keep on learning. And there's a lot of resources available if you just ask, or if you're interested. I've got a lot to share with you. So I'm going to ring the bell and say, Cannabis Classroom is in session. Please do silence your phones if you didn't already. And there will be a Q&A at the end. But do please hold your questions till the end, unless it's a really, really burning question that you got to have answered. So what I'm going to talk about today is how your body works. I'm going to talk about the chemicals, or some of the chemicals that are in the plant that may be useful medicines, and specifically about THC and CBD and why they're called the power couple. So it's estimated that there's over 50 million people using cannabis for multiple reasons across the planet. I don't know, without naming names, how many of you know somebody who uses medical cannabis for any reason? Great. And so this is a list of the medical use. We have over 32,000 patients in the medical program in Hawaii, and the primary reason that any patient uses it is for pain management. And neuropathic pain is one of the things that cannabis has shown to be pretty effective for treating. So everything that's in purple has some science backing it up as far as usefulness as a medicine. So we've got pain, multiple sclerosis. There's actually a prescription drug that's based on medical whole plant extracts, and it's a 1-to-1 THC CBD, and it's being used pretty effectively to treat multiple sclerosis. So for cancer and HIV therapies, there's also a prescription drug, but it's 100% THC. But it's being used to control nausea and vomiting from chemotherapy. Also as an appetite stimulant, but we don't have any real good science on that, but you only have to have had the munchies once to know that it can actually be an appetite stimulant. And as a stress reducer, also for anxiety, end-of-life care, it can help the patients with their end-of-life reviews and just improving their quality of life. It can be used as a sleep aid and also for glaucoma, PTSD, and seizures and epilepsy. And we've got our first cannabis-based medicine available as a prescription drug, and it's primarily CBD, but it also has a tiny bit of THC and a couple of other things in it. So there's other possible medical uses. It might be used to reduce some of the side effects from other medications, such as opioids and benzodiazepines and alcohol, which are the 3 chemicals that people are overdosing on every day. It can also be used to help reduce the use of tobacco and nicotine products. And it's shown to possibly have some neuroprotective properties for chemotherapy patients. It might help lessen the nerve damage from chemotherapy drugs. So it's also being used to treat autism and also being used in dementia care, especially in Northern California. Just about every dementia care clinic in Northern California has incorporated the use of medical cannabis. It's also showing some promise with Parkinson's disease. And there are some therapists who are using it as a trauma, to do trauma work, like psychedelics are being used. And then this is one of my favorites, is that the promise of usefulness in not just skin care, but wound care. The studies that I've read are make me very hopeful. But it's also being used to treat acne, for burns, and infection control in lab studies. It's shown to have some control over MRSA, which is the methicillin-resistant Staphylococcus aureus, so antibiotic-resistant bacteria. So it's also being used in religious ceremonies and as a sacrament. The Rastafarians do that. And also, there's a recipe in the Bible for an anointing oil, and it includes, I think it's 7 pounds of something called cannabosum, which is Hebrew for fragrant cane. So it's quite possible that cannabis oil was the anointing oil. And then also in India, there's a real heavy association between Lord God Shiva and yoga and cannabis. So there's many more ways that people are using it as well. Just for life enhancement, it can enhance your senses, food, music, sexual pleasure, massage, yoga, body work, and acupuncture as the part that they burn, the moxibustion. People use it just for social connection and relaxation. So we have all these stress-related illnesses. Well, that's, to me, in my mind, medicine. And then also for creative energy. Like Louis Armstrong, he smoked every day, except for the 9 days he was in jail, as inspiration for his music and also to relax and to deal with racism. So cannabis also empowers patients to participate in their own healthcare recovery. So gardening is therapeutic. Patients are allowed to grow their own up to 10 plants in Hawaii, but they're also making their own medicines. And what could be better than, juicing a raw leaf and having that as your medicine? People are cooking with it. There's a lot of nutritional value to hemp seed. So I forgot to tell you, in this cannabis classroom, there's no quizzes, but you might win a prize if you answer a question. So who can name the system in the body that makes chemicals that are similar to CBD and THC? What is it?
The brain?
The brain, but what's the name of the system that makes these chemicals?
About hippocampus?
You know it? Sorry? That's okay, take a guess. I can't hear you. Okay, nobody wins a prize. That's okay.
Oh, one more answer.
Yes.
I'm cheating because I have a few words.
Oh, she's looking it up.
Go ahead.
It's called the endocannabinoid system. And everyone has an endocannabinoid system. Everyone who has a spine, every vertebrae has a spine. And that includes your pets, so your dogs, your cats, if you have amphibians and reptiles, or birds and fish. So you can think of it as your cannabis factory. So just like your body produces endogenous opiates, like for pain, your body also produces endogenous cannabinoids. And these act as neurotransmitters. So the system is mostly neurotransmitters and receptors for those neurotransmitters. So the two main ones are called 2-AG and anandamide. So 2-AG is similar to your body's CBD, whereas the anandamide is more closely related to the THC. So it just so happens that the word anandamide is Sanskrit for bliss, or yogic joy, ecstasy. So the main differences are that your body's CBD is more abundant in the brain. There's like 1,000 times more than the THC kind. And the levels are higher during the day. So we think that's related to alertness. Whereas the THC, we think it's likely responsible for not only the runner's high, but for inducing deep sleep, which is the most therapeutic phase of sleep, and also pretty effective at diminishing pain and inflammation. So both of these are present in mother's breast milk. And we think that it's likely useful in activating the newborn or baby's rooting and sucking reflexes and stimulating their appetite. And if you've seen a baby after they've been breastfeeding, they're all blissed out. So we think that that might be the body's THC, the anandamide at work. So both of these also, we're finding that they might be overproduced or deficient in certain disease processes. So we find a deficiency in autism and also epilepsy, inflammatory bowel syndrome, in Parkinson's, PTSD, and in some cancers, and also overproduction in some cancers like endometrial cancer, obesity, and then also schizophrenia. So these receptors are for those endocannabinoids. So you've got the chemicals, now you need some receptors. Unfortunately, these are named CB1 and CB2, real simple names. I like that about it. So the CB1s are found primarily in your nervous system, so mostly in your brain and spinal cord, but there are some in the peripheral nervous system as well. And this is the one that THC binds to that gets people high. It's also found in your digestive system, so we think that might be like the brain-gut mood connection. Whereas the CB2s are found primarily in your immune system. So, and that's everywhere, blood, skin, spleen. So you've got the chemicals and you've got these receptors. And these work in a very unique way. They're different from your normal neuron to neuron firing. You've got one, normally they just fire from one neuron through a gap to the next neuron and just keeps the signal going on. Whereas this one, it's the first neuron sends down a signal and the postsynaptic neuron releases, it makes the endocannabinoids where they're needed, when they're needed to produce the effect that you need. And it's homeostasis that they're looking for. They're trying to balance the systems. And you can think of it not as an on-off switch, but more like a dimmer switch, as Martin Lee points out. Oh. And so it's trying to synchronize to your body rhythms. So there's no drug that can mimic this that we know of yet. So the primary purpose of your endocannabinoid system is to help you eat, forget, to protect you, to help you relax, and help you sleep. And at this point in my presentation, you already know more than most healthcare professionals on the planet. So you can enhance your endocannabinoid system with or without cannabis. And what you eat matters, your activities matter, and I have some handouts for you at my booth more about this, but cannabis works best with education, is what the cannabis clinicians are discovering. And this one, he's a scientist, Justin Kander, says that foods that cause inflammation are going to deplete your endocannabinoids. So they're constantly working to reduce inflammation. So you can let food be your medicine to some degree to help keep your endocannabinoid system healthy. So now you know how your body works. So let's look at the chemicals that are in the plant and why CBD and THC are called the power couple. So everything is pretty much cannabis sativa. I know there's a lot of people say indica, sativa are so very different as far as their effects, but it's not turning out to be very true. Actually, the main distinction between sativa and indica is the shape of the plant. So the sativas are tall trees up to 20 feet. Indicas are short shrubs. And there's another one called ruderalis, which is high. It's bred with these, interbred with these, because they produce flowers sooner. So you get more crops a year. So we're just going to focus mostly on the sativa and the indica. And you can see here, so sativa includes not only the high THC, high resin drug type drugs, but also hemp. So here's hemp. Hemp, nice, tall, stringy, fibrous plants, and they do have some flowers. They're regulated by the USDA, though. And what qualifies it to be industrial hemp is the level of THC, and it has to have a low THC of 0.3% by dry weight. So something that you should know about all cannabis sativa, though, is that it can remove toxins from the soil when it's growing. So they used hemp to help clean up Chernobyl. So if you're concentrating that and using it as a medicine, you really should learn to read lab test results and labels so that you know not only what you're getting, but what's not in it. So make sure that there's no heavy metals in it. So, time for a quiz. No. Just kidding. Okay, so what's the major difference between cannabis sativa and indica?
How tall they are and how fat they are.
Awesome, you win a prize. So,
That says no prize.
what? I says, no, just a prize. So I'm going to give you a coupon, and you just bring that coupon to my booth, and you can pick a prize. But I do have some really good books, especially this one. This is a really great guide to CBD. So that's one of the possible prizes that you can have. So the medicines are made in these resin glands called trichomes. And these are those frosty, mushroom-like looking things that are on there. And they're sticky, and they're fat-based. So the unfertilized female plants make the best flowers and the best medicines. A single male plant can destroy your whole crop by pollinating it and turning it to seeds. The word sinsemilla is sort of a reference to the female plant because it means no seeds. So 3 main types of phytochemicals in cannabis sativa, and those are the cannabinoids. There's 146 or so of those. And the most abundant and well-studied of those are THC and CBD, and you probably know something about both of those. But then there's also about 200 essential oils called terpenes, which also can have some therapeutic value. And then a smaller group of flavonoids, which pretty much contribute to the color, but there have been, there are a couple of patents on it after some cancer studies were done showing some promise with pancreatic and breast cancers. So I won't talk much about the terpenes, but just know that they are an important piece of the medical cannabis puzzle. So these are essential oils. They're found in all fruits, flowers, herbs, and trees. And while many of them might have some therapeutic values, they also might be responsible for some of the side effects. So knowing what's in your medicine extends beyond just knowing how much THC or CBD it has in it. So the way that we categorize the plants, though, in medicine, this is the language that we're starting to use. So we've got chemotypes. Rather than saying sativa or indica, we're looking at ratios of THC and CBD. So the first one is THC dominant, the one in the middle, more balanced ratios of the THC CBD, and then also the third one is CBD dominant. And I've got a really good book at the booth about the ratios and how to use that. So, okay, check how your body works. Now you know more about the chemicals in the plant. So why are they called the power couple? Well, let me give you just a little backstory on, first of all, that both THC and CBD come from a mother molecule called CBG, which is also being shown to be a very promising therapeutic tool. So, and it forms an acidic version of THC and CBD. So if you look here, so THCA, the A part, that's what you find in the raw plant. So if you were to pick a leaf off of your plant and eat it, it shouldn't get you high because it's not psychoactive. It's only when you heat it or age it that it becomes the psychoactive THC. So, and then it actually gets even stronger if you eat it, and it goes through your liver, and your liver converts it into an even much stronger version of THC. So that's why dosing can be pretty tricky with edibles sometimes, because how much it makes it stronger might be dependent upon how fatty your meal was. So, but all cannabinoids are related, but they might have different effects. So THC, what's hot and what's not? So for some people, well, just like I said, the THCA, is not psychoactive and is useful. But what's not so hot is that the Delta-9, the heated aged one, is psychoactive, and that limits its use in medicine to some degree. It just makes dosing a little more challenging to get the desired effect. And that being said, we have hundreds of thousands of patients who have managed to find the right dose and are using it to treat their disease just fine. So it may not be safe for certain patients, though, because it can make your heart race. So certain heart patients, it might not be good for them. It might trigger early schizophrenia, which is harder to treat, but that's generally only in people who have a genetic predisposition to it. It does not cause schizophrenia in normal, healthy people. And it can have drug-drug interactions. So if you're taking other medications and you get, you need to watch your dosing on THC and try to balance that out so that it doesn't affect your medications. And then also long-term heavy use can lead to some serious health issues. It can, if you smoke, it can it can make gum disease worse. And we're seeing something that's kind of problematic in ERs, and it's called hyperemesis, and it's cyclic vomiting. And these are generally people who have long-term use, moderate to heavy use of cannabis, and the only real solution is to stop using it. So, but more about what's hot about it. So THC is very medically useful for pain and inflammation, as a muscle relaxant. It may help reduce the Alzheimer's plaques and help immune system balancing act. So CBD, let's look at that one and say what's hot and what's not. So there's actually a lot hot about it. It is psychoactive because it can alter your mood, and it can also interact with THC and modify how the THC is working. So it's also hot because it helps keep your body's anandamide, the bliss molecule, in your body a little bit longer, so it could be helpful for mood. And there was also a study showing that a 1-to-1 CBD THC, that the CBD helps buffer the psychoactivity of the THC, so it helped resolve anxiety and paranoia. And then the last one, that cannabis or CBD can actually block THC from changing into the more potent form in your liver. So what's not so hot about it, though, is that it can be sedating, and that both actually THC and CBD can have what's called biphasic dosing. So you get one effect at a low dose, and you get the opposite effect at a high dose. And I'll use an example from THC. So some people use it to help reduce anxiety, and that might be the low dose. And then if you get too high of a dose, it can make your anxiety worse and lead to panic attacks. So also what's not so hot about CBD, although it can potentially make some conditions worse, like glaucoma. It can raise blood pressures in eyes, but it can also drop your blood pressure and make you pass out. So, and again, it can also have drug-drug interactions with prescription medications. And that's on medications that need tight controls on their dosing. So it's not that you can't use it, it's just that you need to work more closely with your doctor, maybe to have lab tests done more often to make sure that the levels of the drugs are within safe measures. So one last study, I think. So this was a patent that the Department of Health and Human Services took out in 2003. And they studied cannabinoids. I believe this was all lab studies, like mice. But they discovered that there are 5 cannabinoids that have neuroprotective properties, and this includes CBD, THC, and 3 others. But what they found was it could help limit damage from ischemic stroke and from traumatic head injuries. And that it also might be useful in treating Alzheimer's, Parkinson's, and HIV dementias. And I'm not going to go over this chart, just to show you, though, that there's overlap. So there are different versions of THC and CBD, and they have overlap in their properties. So why are they called the power couple? Well, there's a theory that whole plant medicines, they work better together instead of having one single substance to try to work with, that they're better together. And you can use lower doses of both THC and CBD when you combine them. So that's good news, because then there's less chance of drug-drug interactions or side effects. So for an example, there's low doses being used to treat, in that prescription drug that I told you about that's being used to treat multiple sclerosis, that 1-to-1, well, the dosing on that is like 2.5 milligrams of THC and CBD. So even if you took it a few times a day, it's still a pretty low dose. And then with epilepsy, they're finding that the CBD-rich extracts outperformed the purified CBD, which is the prescription drug one. So there was an average of just 6 milligrams, 6.0 milligrams for the CBD-rich extract versus the purified, which was 25 milligrams per kilogram per day. So, and then they saw more adverse effects in the purified CBD than the extract. So anyway, so they can allow for higher doses of THC some patients need higher doses of THC. So CBD, I think by helping buffer out that psychoactivity and helping balance it out, if you need higher doses of THC, it helps enable those patients. And just one last quote from, this is Dr. Ma. He's the chief of the Comprehensive Epilepsy Program in Colorado. And he says the desire to isolate and treat with pharmaceutical-grade compounds from cannabis, specifically CBD, might be inferior to therapies that with whole plant extracts. And we're seeing that over and over again. And cannabis clinicians have found that cannabis works best with educated healthcare professionals and users. And again, this is a great book. One of the people who helped make it happen is Martin Lee, and he's sitting in the back, and he might be hanging out in my booth and can tell you all about, he knows more than I do. Anyway, and then my top 3 picks for books at my booth. For this one is good for anybody who wants to learn about the endocannabinoid system and how cannabis is being used to treat pediatric patients with cancers and autism. And the other 2, they're handbooks for clinicians. So that one is for nurses, and that one is for doctors. And so anyway, cannabis classroom is dismissed. Am I supposed to ring the bell again? Yes. Okay. So does anyone have any questions?
I have a question.
Yes.
What do you think, what are your thoughts about the whole flower versus some of the other, like the shatter and some of the other products that are being offered at the dispensaries? Well, I mean, you know.
Well, if it's a whole plant extract like a resin, it has a lot of the good chemicals in it. It's versus the flower or so concentrates. So it's concentrated when you get the resin squeezed out of it or you extract the resins. So you probably don't need as much, I would guess, because it's concentrated.
And it's still safe?
I believe so. Well, extraction technique matters a lot. You know, you don't want any solvents in your product, so solventless. There's some really good guidelines on a website called Project CBD. And if you go there, they have a really good guide to how to choose products. And they can probably answer all those questions. Sure.
Okay, you said something also
Yes.
about juicing.
Juicing.
Leaves.
Yeah. If you can grow enough plants to juice, patients can only grow 10 plants. But they've found some good therapeutic usefulness for the raw form of THC in that.
But if you juice it,
Yep.
don't you need to then heat it to release the active?
Not if your aim is to use the THCA, the acid form. Yeah, so your goal, because it's not psychoactive, you can get the benefits of the medicine without, getting high or, I mean, if getting high is...
THCA on labels.
Well, it is. It is on some of the labels. And there's some people who are marketing this THCA product. Mm-hmm. Yep. And, yes.
So can you juice the leaves and the stem?
Can you juice the stem? I don't know. They're pretty fibrous. Martin, do you know that? Can you juice the stems? Yeah.
Juice the roots?
Oh. Okay, well, I think that's great. Thank you. Any more questions? Okay, so come to my booth and claim your prize. when we're done.